Fire, fire, fire. Kill it. Rasta music, Rasta music. Yes, sir. Yes, sir. Yes, sir. S-I-N-Y. Yeah, man. Yes, sir.
Hey, welcome back, welcome back. LiveThatSINY, your host, John Dreads. And once again, we got a banger. Because you're either going to learn something new here or you're going to learn more knowledge to what you know already. You know what I'm saying? And we brought in Dr. Pedro, who is more than my dentist. So I'm just going to let him introduce himself and just introduce yourself. We ain't gonna tell them exactly about you yet because, like I said, it's more than dentistry. You know?
Right. Well, I just want to thank you for having me. I'm Dr. Greg Pedro, native from Staten Island. I've been here my formative years and all the way up until college days. Left for a while, now I'm back. Since Hurricane Sandy blew me back into the picture again. I've always loved Staten Island. Deep history here. My grandparents grew up here. My parents grew up here, and then I had the sunshine of them, coming before me. Played a lot of sports here, and then I became a dentist. So now I'm back, hopefully making Staten Island a little bit more brighter as far as it comes to smiles.
Oh yeah,
and healthcare, and so. But it's a pleasure to be here, and
yes.
I'm looking forward to this time together.
Yes. You know what I'm saying? So this has been in the making for a while. I actually been trying to get you here from last year, and I don't know where to start at because you come from just a legacy and then you're a legacy yourself. You understand what I'm saying? So let's start with you were born here, right?
Mm-hmm.
And tell us a little bit about that,
Well, I was blessed to be born to Christine Felton and Hank Pedro.
Right.
More people probably, if you're from Staten Island, would know Hank Pedro. He was a local hero, sports hero. Played for Port Richmond High School with some greats during that time in the 60s, and then he went to Wagner College.
Oh, wow.
When Wagner was on the map for beating NYU, he happened to hit the big shot that beat the nationally ranked NYU team. And so I was born in '65, and my grandparents were in my life, and so I was born at a really good time. There was lots to celebrate. There were a lot of people who were in my life early on. I'm the firstborn in my generation, and so I was born in '65, so that makes me 60 today. And but I feel like I'm 30 right now.
Right. I'm pretty sure they're looking at you like 60, right? Right. They're gonna check your credentials, like make sure you're 60. But
right. Age is just a number. It's more of an attitude thing, and so
taking care of yourself. And
So we could talk about a lot of things today. We could talk about Staten Island. From my perspective, from my family, from sports to healthcare.
Right.
I love it all.
You mentioned your family, and you I ain't gonna say downplayed it, but you actually really do come from a legacy family when it comes to like the baseball out here, especially for African Americans, right?
Right. Yeah, my cousin Julian Bowers.
Okay.
He played in the Negro League with Hank Aaron. So they were actually shared. They were roommates.
Okay.
Before Hank Aaron made it into the Major League Baseball league, and so and he probably should have been there also. But as you know, there was quotas, and there were limitations at that time. But he was a great catcher.
Right.
And so. So he had some great numbers too. He should have been a Major League Baseball player, but he was a great player in his own right. So baseball was always a big part of my family as well. You know,
Right.
my father was a catcher, probably inspired by
Okay.
cousin Julian, and my father actually played for the American Legion baseball league at that time, coming up as a teenager, and they played in that level's world, championship game
Right,
in,
right.
in Williamsport or Cooperstown. And so when I came up, naturally, my family loved the Dodgers. When the Dodgers were, in New York City, so then they became the Mets, and so I was a Met fan.
Right,
You had to be. And used to go to the games when I was a kid at Shea Stadium.
How about Ebbets Field?
Yeah, I didn't know Ebbets Field.
Okay.
Yeah, because that was a little bit, before me.
Right,
But yeah, baseball was always a big part of my early years. I actually played originally at Mid Island.
Right.
They had not too long ago before that won the Little League World Series. So that was, one of the things that I love about my dad is he always got me good coaching where you can learn the fundamentals. So I got off to a real strong start in baseball. So baseball was a big part of my early years, from probably 4 years old at least until 17.
Wow.
Yeah, I played a lot of baseball. Yeah.
Right. So now you got to explain how you got out of the sports career and got into the dentistry,
Well, just like I give my father all the accolades for basketball, I have to give my mother on the healthcare side, because she was a registered nurse. She did hemodialysis at Staten Island Hospital when Staten Island Hospital was on Seaver Avenue.
Oh, okay.
When it was just like a little building,
Right.
before it became this big, operation now. So she used to treat the patients who had to get, their kidneys cleansed, with dialysis.
Right.
And I remember during that time that she actually studied to become a nurse at College of Staten Island when it was at the Petridis location.
Okay.
And I was probably little enough to sit on her knee when she was taking some of her classes, and I remember, her taking some of her lab classes. So my eyes were open to the different things. I think the day that I remember the most, they were actually dissecting the eyeball.
Oh, wow.
So they had this jar, which I'm sure it doesn't sound sexy, but they were actually dissecting. It was probably an anatomy class. And I was fascinated by it. I wasn't scared. I liked it. And then she had all these textbooks, so I would always look in her textbooks. So I think that that has shown me that I like biology. I like the anatomy of the body.
Right.
I always leaned towards that in school. When I was in high school, I did well in biology. And when I was in college, I liked those types of classes. So I always leaned towards like that. I didn't love school, but I loved those subjects.
Right.
And so those I knew I had a passion for like the healthcare, health sciences. Back then at an early age.
Right. And I mean, times was different. Now, we'll say since pandemic time, people don't really have like a clear picture of what they want to do in life or what they want to be in life or even what their next move is now. Right. So it's been a big change,
Yeah. Well, it's tougher now,
It is.
because technology's,
Very
moving people around and it's hard to confidently say what I like is going to be something that I can, do as a profession.
Right. Or just even picturing themselves. It's different. Like before, I could look and I could see all of my next steps of what I want to do and, what goal I got and how I want to get to the goal. And now it's like you can look, but you don't see no clear path to where you want to go because everything is unpredictable now.
Right.
You know.
I would have to say, I mean, from my perspective, I don't know if things were clear even back in the day. You know what I mean? Like for me, I always followed my passion. You know what I mean? And that is always my that's still my advice if I have to, take my own advice or have to give advice to me. I like to speak to the youth today, and I always say, you can have a plan. One of my favorite sayings comes from a poster I saw of Mike Tyson,
Right.
who said, everybody has a plan until they get punched in the face, right? And you're gonna get knocked down even if you have a plan. But if you're chasing something that you have passion for, you'll get back up and you'll figure out a way around it, or you'll make an adjustment, or you'll meet somebody along the way. You know what I mean? And that's always happened to me. Like, I've always had no fear of going after something, whether it be in sports or an opponent or going for a job. And I've always thought it was going to go this way, but it's always happened some other way. But if I didn't take the first step, and if I didn't really have the belief that I could get there, I just don't know how I'm going to get there, but I'm going to get there somehow.
Right.
You know what I mean? And don't worry about the whole plan. Have a plan, but don't worry about the plan working out, because it almost never works out the way you planned anyway.
You gotta have like 5 plans. You know what I'm saying? It's like playing chess.
Right.
You gotta know what's going to be the next move. And the next move after that.
But if you stir up the fire that you want to get over there, whatever over there is, the plan will lay itself out.
Right, and then anything can happen when you're serious about it. Okay, be surprised. Our ancestors still here fighting for us, still opening, kicking in doors for us. So you would really be surprised. Like, growing up, I knew from young I wanted to be a judge. You know what I'm saying? So that was like my focus the whole time growing up. And then even when I got to college, I took criminal justice. And then as I started learning more about it, I was like, look, okay, they're telling me that you can't associate with criminals, okay? My whole family is criminals. So you telling me I can't talk to my family now? Like, that's it. Change my major. I'm done with this.
Yeah, it's okay to change, right?
Right. So, as I got to where I wanted to go, it was like, oh, no, this ain't really for you, because the person, I seen what I would become. You know what I'm saying? It was already hard for me growing up, being that I had the knowledge, and I started school at 9 months, and I always was like a studious person. My whole family come to me for knowledge or questions or help or anything. Even if it's just to spell a word, they still was coming to me. I was like a walk-in TV guy. They'll call me. They're like, oh, what time this show come on? I know it. They call me. They ask me, oh, what's iguana? I know it, okay? I can give them all of this stuff, but in my time, we had encyclopedias, we had books, you know what I'm saying? We read stuff. It's good to watch it, but to me, it was more joy of reading and my imagination taking me there and, picturing it here than seeing it, you know what I'm saying? And that's what pushed me more to want more knowledge and want to know more. You know what I'm saying? And I think that's a major disruption with the kids. They put everything on the plate one time. Okay?
Right.
So they quick to say they don't eat this and they don't eat that. You understand what I'm saying?
Yes,
right.
yeah.
But they never tasted it, so they don't know if they really do. Okay. So this is the kind of world that we live in, and
it's everything's coming at such a faster pace. I mean, things used to unfold a little slower. Like you said, you can taste a little bit of this and a little bit of that, and if you don't like it, you put that down, you try this. Now everything's coming at a lot of speed. So, but I believe that with everything that we have today, it is difficult, but I think that I always believe in that we'll figure out ways to adjust. We got AI now. We got all types of things coming down the pipe. We need to do another show, right?
Right. No, but you can talk about it. It's just that a lot of people don't know. You can't trust that AI, okay? And don't think that you're getting an AI as an agent and then, oh yeah, all the work gonna be done. That AI, okay, is gonna run you through the mills, okay? Probably take over you, okay?
It's taking over.
Right, but I mean, start ordering stuff you ain't even you either order, okay? It's just gonna pick what it want to pick for you. It's just gonna get the food that it feel that you need to eat. It's just gonna stop you. Well, you spent $100 last week. You don't need to spend no money this week. So, there's a lot that comes with that AI that, we have to be careful of giving it that,
Yeah. Well, you have to take it one step at a time, because some of it is the uncertainty of it. Like we're dealing with it, and it's here. It's going to be pros and cons, just like the computer. Pros and cons, just like we had people would read books and use their imagination more so than they do today because we have everything kind of right in our face. You don't have to think as much.
It's not like, okay, we could be snappy towards each other as human beings, but for the robot or the AI that has all your information, all your health records, everything in there, to just start throwing stuff at you and talking to you a certain way, you know what I'm saying? That could be real scary.
Yeah.
Okay.
Yeah.
I don't advise nobody to put none of their personal information in there because anybody could go maybe to Chat GPT and say, give me Dr. Pedro's social security number. And guess what?
Well, I hope it's not that. I hope it's not that wide open, but
it's like
we'll have to see. Yeah.
Right, it's like that.
Yeah.
It is. It is.
I had a friend who lives in Greece, and I hadn't seen this person in a long time, and they looked up on something on Zillow, and they sent me a screenshot of my house, and they circled it and said, "Hey, I found you." So privacy has been an illusion for a long time. This was probably 15 years ago.
Oh, so that was just the
yeah. So.
That's not the advanced ones that we're dealing with now.
No, it was some kind of a satellite. Because we have satellites and they've been around for a long time. Technology's been here. It's been here.
It has. But the biggest thing is this portal that we walk around with, that we give access to everything. I just heard that it's recording us while we're sleeping, so you should have them turned off at nighttime.
Right.
And it's just a dangerous situation.
Yeah, I guess so. That's why you gotta live. You gotta live a good. What your definition of how you want to live.
Pursue the happiness. But what happiness can you pursue? And these days, when the cost of everything is skyrocketing,
Right. Well, all I do is fix teeth and play basketball and eat. So if you want to watch me, go ahead.
Right. Oh, they're watching you now.
I'm boring,
Right. You think you would think that you was boring, but it's people who don't even do that there. Okay?
Right.
They don't even get off the couch. Okay. Right. The people that stay up all night, sleep all day. Okay. They ain't got a care in the world, a worry in the world. They're not thinking about the legacy they're leaving behind. They're not thinking about what they're showing society, what they're showing the younger generation, which is the future. They're not thinking about none of that.
Well, I think people need to get the messaging, and of course, everybody's got a different journey, but, I truly believe that inside of each person is a light. There's divinity that we're born with. Like, you don't have to do anything. You're born with that beauty inside. And now society sometimes will pile on top of that so that you don't realize that.
A lot of times.
You know what I mean?
A lot of times.
And the messaging that people get. But what they need is this message, that you're born, unique, and you have a beauty inside of you already. You know what I'm saying? And if everybody was that way, we would all be a cool society. But we grow up thinking that we have to.
Right, they didn't like that.
I know that's a utopian.
But they didn't like that. Remember when Mr. Rogers was telling people they were special just because?
He was telling the truth though.
Right. You see how they went after him. You understand what I'm saying? So they don't like that. And then it's so funny how we might have Bruce Jenner's daughter, okay, who ain't have a struggle in the world. And then she takes what she was born with and flips it to a billionaire, okay? And they say, oh, she's the first female billionaire, and blah, blah, blah. But then you have somebody where it's like power, every trial and tribulation, once they get through one thing, something else happens.
Yeah,
It's like a Debbie Downer. Like, oh yeah.
But I, you know, I never want to blame the victim. But I'm just saying, like, if you grow up knowing, not I think, or you know, if you can grow up knowing your self-worth, you don't really care what anybody else thinks.
They don't have that.
Yeah, I know. That's what I'm saying. It's a kind of a utopian idea.
Right.
But I'm saying, I mean, I look at any person, whether they have money or they don't have money, whether they have status or they don't have status, you're the same. You know what I mean? You know, you're the same. Like, I treat you the same. You know what I mean? Like, I don't need to treat you less just because, you know, maybe you have had a harder upbringing or you have a different mindset or you don't see your self-value, your self-worth. I see it.
Right.
You know what I mean? This is the way. This is how I roll. You know what I'm saying? Now, you might have a different experience with somebody else who looks down on you or even thinks you're better than everybody else. Then that's a whole different dynamic you're going to have with that person. You know. But as a healthcare provider, I don't care if you have insurance or not. My staff will tell you. My staff will tell you. I don't treat you any different because I'm in it for you know, you have value to me. I want to get you healthy. You know, in dentistry, everybody's scared of us. So my main goal is to give you a good experience because, you know, I take my job serious that you need oral health to be healthy. You can have all your other body parts healthy, but if your teeth are messed up, you have gum disease or whatever, you know.
How dangerous is that? How dangerous?
Yeah, you know, we you know, it's known, but I don't think it's taught enough in schools, or I don't think it really has made it as mainstream as it needs to be. That if you have gum disease, then you put every organ system in your body at risk. Right. Because there's bacteria going through your circulatory system.
And then you're going this way.
And some of it is very.
Sometimes it goes this way and turns to aneurysms.
It's going to go. Yeah, it's going to go where it can go. You know. Right. So that's why, like, if you have like a heart murmur, or if you've ever had a joint replacement, what do? They give you an antibiotic before you get your teeth cleaned. So that antibiotic will be in the bloodstream to kill any bacteria, because it's known, medical science knows that bacteria will travel throughout your body. So you take an antibiotic an hour before you get your teeth cleaned so that it doesn't cause any problems. Right. But what about when you're not taking the antibiotic, you go brush your teeth, or, you know, you're just, you know, you're causing that bacteria some way to get entry into your gum, through your gum line, and it gets into your body, you know, and that's causing inflammation in your body. So that can cause any of the things like heart issues or you know, vascular problems, a number of things, you know. Right. So yeah, so oral health is extremely important, you know, and every medical profession, you know, like, you know, you've heard of people who are going to have a medical procedure. What do they say? You need to go see your dentist to get clearance. You know, so if you have any teeth that are infected and things like that. So it's extremely important. It's not just important when you have to go get an operation or when you get your teeth cleaned. Right. It's important all the time. Right. You know. No,
it's true.
Right.
There was a recent story about an older man who, he didn't have no symptoms, no warnings, and then when he went there, this stuff had went to his brain. Right. He was almost dying, actually.
Right.
Okay.
Yeah. These are what they call opportunistic infections. I mean, if there's a weakness somewhere in the system, that's where the bacteria, if there is bacteria, is going to go. You know. Right. So, but you know, oral health is not that difficult. You know, it is because we have habits. But like, if you're doing, you know, because if you're doing plaque removal, that's where the bacteria is in plaque. And plaque is easily removed if you just, you know, brush and floss. Right. If you just do that one thing, you'll live, you know, there's science that says if you brush and floss your teeth every day, you'll live X amount of years longer. You know, because you're not putting your body at, you know, where it has to fight. You know, our bodies are amazing, right? Even if you have plaque and calculus and bacteria going through your body, our body's fighting it and keeping us,
Right.
keeping us okay.
Right, because our
But-
bodies
right.
can fight
But,
these
yeah,
things.
But if you're not taxing your body every day by having that load of germs, that is, so to speak, going through your body, now your body's free to chill, relax, do something else.
Right, right.
You know what I mean? So oral health, definitely
Right.
really, really important.
How important is it, like, because times have changed. When I was growing up, dentists used to visit the school and give out toothbrush and give
Yeah,
these
yeah.
lessons. They don't do that no more. So we have a lot of kids that grow up, they didn't even brush their teeth, sorry to say.
Right.
So flossing is like a foreign word to them.
Right,
Never heard
right.
of that.
Right.
But then it begins with home training from the parents. Okay.
Right. I think in the evolution, I mean, I've been practicing for over 30 years.
Right.
So I think that tooth decay, while it still exists, it's better, because there's more choices. There's different types of toothbrushes, different types of toothpaste.
Right.
The generation, our generation, I think has done a better job than the generation before, where there was almost an attitude that, you're going to lose your teeth. I don't know if there was enough public education on how important and how you can prevent cavities and tooth decay and gum disease.
I think it was just cool.
I think
Right.
I think it's better.
Yeah, now.
It's
right,
better. You know
now.
what I mean? So I don't see a lot of kids because I deal with more adults.
Right.
But I have done some general dentistry, over the years. Fluoride is a little controversial, but I mean, it's
A little?
yeah.
Right, a little, Dr. Pedro?
But for the most part, most people have been exposed to fluoride, and the benefits of fluoride to the teeth has been tremendous. So more of your younger kids, who have had either their mom take fluoride supplements while they were, having a baby,
Right.
and fluoride in the toothpaste and fluoride in a lot of areas that have fluoridated water, that has made the teeth more resistant to cavities. But that hasn't done anything for gum disease, though. That comes from brushing your teeth and natural, plaque removal every day.
Right. Right.
So while we're seeing like less cavities, gum disease still running a little
More. Right.
It's still running around.
What's the earliest should people start seeing you?
Bringing the kids in?
Right. What's the youngest age?
I say, you should be a good model for your kids right away, so they see you brushing your teeth.
Oh, right.
Yeah.
Right. 2025.
It starts at home, like
right,
you said,
right.
and then if it's feasible, have them come to a dental, visit that you have, if you have, a nice calm kid and the office will allow you to bring your daughter or your son with you.
Right, like your office.
Maybe when they're about 3 or 4, if they're not, hyperactive,
Right. Because it's dangerous.
Right. And let them see you. You let them get, comfortable at seeing that. And then you go from there. But somewhere around 4 or 5 is, a good time.
Because did you see the story about the baby that they took? And I think they only were supposed to clean his teeth, and he ended up dying inside.
No, I haven't heard that.
Yeah, this happened last week.
Oh wow!
Right.
No.
Right.
Yeah, that's tragic.
Right. Parents devastated.
But when you think about it, you want to introduce them as early as possible, right? Because the permanent adult teeth start coming in maybe as early as 4 years old, somewhere between 4 and 6, depending. And so it's not like you don't take care of your, the baby teeth. You don't want to take care of, the baby teeth. Yeah,
right.
they're going to come out.
Right.
But when you start getting into 5, 6, 7, and the adult teeth are going to start coming, like your 6-year molars.
Right.
And that's the time that you have to watch your kids because they may be a lot of juices and sodas and candy. And so
the go-to.
Yeah.
Right.
So if they're not
The
brushing their
go-to.
teeth and they're having that constant exposure to the sugary types of foods, you could be setting them up for for some problems later on.
I mean, you know, a lot of these, we don't have like home cooked meals no more. So a lot of the processed food is filled with that
Right,
sugar.
right.
Hey, the drinks, you say water, oh, right.
Yeah,
Okay.
water isn't popular sometimes.
When I'm a water fiend,
Uh-huh.
I can drink water all day long. You know
Right.
what I'm saying? Even like regular drink, it don't have to be sweet. I don't like it sweet, sweet. You
Right.
know, even though my family is from the South, where sweet tea rules everything. You
Right,
know,
right.
I like my stuff kind of bland. You know what I'm saying? I don't like all
Right,
of that
right.
sugary stuff.
Right, right. Yeah, it's interesting. I'm not against, you know, an occasional snack or candy or soda, you know, things like that. You know, it really comes down to really educating people on plaque removal, because obviously, if you have pristine teeth that are polished and have nothing on it, then there's nothing for the sugar to really stick to, right? So plaque removal with floss or really good brushing, you know, there's that saying that only brush the teeth that you want to keep, right? And there's
we
a
want
lot of
all of
truth to
them,
that.
right.
There's a lot of truth to that because plaque, we all, you know, it's impossible to not have plaque on your teeth, you know. And when we eat, the food that we eat, a lot of it still sticks in between our teeth, and that's where, you know, that's the plaque that sticks between. And now if you come after that with sugar or candy or whatever, the bacteria that's going to be in that plaque sort of takes it in, and it creates an acid, and that acid is what causes cavities, you know, and also the bacteria that can get in to the gum line. So it's really brushing and flossing. If you brush and floss, you can eat a little candy, you can have a little soda, you can have a little sugary stuff. It's not really great nutritionally, you know, but,
Right, but how about your patients, like your senior citizens or the people who can't floss because the teeth is plastic? You know what I'm saying?
well,
Right.
They don't have to worry about cavities.
Right. Do they got a fake
They
floss?
lost the war at that
okay,
point.
all right.
Our job as dentists is to not let you get to that point, hopefully, right? But yeah, you know, it's really a big thing. You know, now I'm a prosthodontist, so that's my specialty. So a prosthodontist sees a lot of people who have lost some of the war.
Right.
You know, they've had cavities, so they've had to have teeth removed. And my specialty, you know, deals with the replacement options. You know, might be an implant, might be a bridge, might be a denture. You know,
Right.
but then, you know, also trying to preserve, you know, what's still good. You know, so maybe you lost a tooth, but now we don't want the teeth to shift. Or maybe you lost a tooth and now we want to replace it so it feels like, you know, you're back to 100%. You know.
And then some people just have their mind made up because while I was at your office the last time, I heard a lady saying, "Oh, I'm taking all of them out."
Oh, please, I can't. Listen, what they
I'm
do
like,
is,
whoa.
yes, we cannot make the teeth like you were born. You know what I mean? Yeah, that's impossible. You know, these grew out of your jawbone, and the gum tissue loved it, and it was natural. Now, when we come in with these artificial pieces, not that they don't work, but you're never gonna, you know, if you make that hasty decision to take them all out, and there are some situations where we need to, if you're that far, you know, on the side that things are breaking down.
With decay and all of
Right.
that.
But, you know, what you don't realize when you take all your teeth out, the bone now recedes over time. The tissue shrinks. You start, you know, losing all that facial support where you look old and vibrant. I mean, you looked young and vibrant. Now you look old and the function, like, you know, your biting strength is dramatically decreased when you wear a denture, as opposed to, even if we save 4 teeth and we can still make a denture, but we save some anchor teeth, you could still function. Now you have something that's going to be, you know, more comfortable. It's not going to move around. You're going to have as many changes in the mouth. And so, yeah, so, you know, I love that discussion, you know, because I've had so many people say, "Oh, doc, I've had root canals, I've had painful teeth, just take them all out."
A lot of times it's from dealing with the wrong dentist, and I know you're a dentist who a lot of your patients then dealt with the wrong dentist, so it's like they come to you and they already have these preconceived notions and diagnoses. Like, I'm just gonna get them all removed, okay? And then they had like, I ain't never got to see a dentist again.
Right.
But in reality, you know what I'm saying? You just broke down the importance of trying to keep your natural teeth there.
Well, it's very challenging. Like in any profession, you're going to have a variety of you have the spectrum, right? You have the quick fill kind of a dentist, and you have the specialist, and you have everything in between. You have the dentist that's really, really good and caring and takes his time, his or her time, explaining things, and you have the one that's scheduled is double booked. So you have to
just don't have a heart.
So you have to find what fits you as a patient. You know what I mean? So, for instance, as a prosthodontist, I'm trained to do a full exam. I'm trained to see you for an hour for the first time. I'm trained to look at all the x-rays, find out why you're here, what you want, make predictions of where you're headed, find out if you're scared, you're not scared, schedule you appropriately, all those types of things. Now, the hard part is we get into insurance, and so as a specialist, insurances don't reimburse a doctor like me to spend an hour. So that's terrible. You know what I mean? I want to see everybody for the time that they deserve.
Right.
But then I can't run a business if I don't get reimbursed either, because this costs time and there's materials involved. So we that's the battle that I fight. But if your teeth really mean that much to you, you got to find a way, because this is your life. This is your quality of life. And you can't rely on insurance to help you. You got to find a way. You got to get your family to help you or whatever.
But you know what? More than ever, we got AI dentists too. Okay, that's making their own bridges. They're making their own implants. Okay, and these people is going on TikTok. Right.
I order their teeth on Amazon.
Right, Amazon, TikTok. Okay, Best Buy. Okay, right.
Yeah. Well, that's been going on for years too.
Right, but more than ever now, because before it was like it wasn't so good. Now it look like some of these people look like they had the $100,000 dental work done, and it's just something they bought online.
Right. Hey, if there's a big event coming up, I don't criticize that, but I do. I criticize it in terms of, for instance, they have these snap-on teeth.
Right.
You've probably seen those.
Yeah.
And they look, for some people, they look beautiful. But you can't go around wearing snap-on teeth and where you can't floss anymore. They might look good now, but then they cause a problem underneath it, right? What's going on underneath, right?
Decay,
so it's a short,
bacteria,
it's a short, we used to call them party teeth. Right. You wear these at the party, but then after the party's over, you take them out and go get them done the right way. Or at least make sure you're not going to cause a bigger problem down the end, down the line,
Right.
So whatever you have to do to get to the party, but when the party's over, don't do more damage to yourself,
Right,
because
so it's a temporary fix.
It's a temporary fix.
Permanent.
Obviously nobody wants to walk around with a missing tooth, so especially if you're going to go to a reunion, or you're going to a wedding, or you're going to some big event, of course, go ahead and do that. But don't get educated on what your situation is, and don't take.
Right.
Hey, listen, I went to school for an extra 6 or 7 years after undergrad college. I know. You can't just go online, for 10 minutes and learn what most dentists learn in 4 to 6 or 7 years,
Well, you are old school dentists. These new school dentists, I'm pretty sure they go right to the AI. What's wrong with you? I'm having to pay hair. And they go right there, they type that in the computer.
Scary.
Right, and they wait for the AI to tell them what to do. Then they come back and they say, oh, well, we're going to do this and we're going to do that. And it might not be warranted. It might not be needed.
Well, that's why you have to spend time talking to your patient, though, It's a relationship, You've been there.
Right.
We talk, I get to know you, and you get to know me.
Dr. Pedro.
While I'm interviewing you, you're interviewing me.
Right. But, when I first came there, because of my last name,
Uh-huh.
because of your basketball history, he's like, oh, okay, we got one of those here, okay? I don't know what the Bronsons they did to you on the basketball court, but you came like, yeah. Oh, yeah. And I'm like, no, this is my cousin. No, not me. You know what I'm saying? And then we got from there because I'm like, no, Dr. Pedro. But from day one, it was a total different. I've been going to Dr. Can I even say his name?
Yeah.
Right. For at least a couple of years. From Amboy Road, okay?
Right.
No, even before that, from
Castle-
Clove
yeah,
Road, okay?
Clove Road, right.
Right. I've been going there from then. And the office, beautiful. I tell everybody, this thing like a spa, okay? It was so nice over there. But the chemistry, it was like, oh boy, okay?
Yeah. You had a little rough. You had a bump in the road.
Right, and
Yeah.
then it seemed like he got pissed off because I said, oh, you know, Invisalign, they stole, because I used to go to school in Daytona Beach. I used to go to Bethune-Cookman, okay? And I ran into the guy, and he practically, you see how the bootleg people go, and they check all your stuff so they know how many stitches to put there. He looked at my mouth. He's like, oh, those things is, I had gold. He's like, those are like retainers. Oh, okay. And then he just took it and ran with it. And then all of these years later, I'm telling the dentist, like, let me get his information. He owed me a couple of dollars. And he just was more concerned about the demonstration that they was having there at that time. Like, don't show up, don't come here with that. We don't need that right there. And it just kind of pushed me off, you know what I'm saying? Because I'm telling you that, and all you're telling me is the implants cost $10,000. You just see, like, right?
Yeah.
Okay, that's not the way to go for everybody. Some people might want it, you know.
Well, you know, my philosophy, like I said, I treat everybody the same. I lay out what your options are, from the ridiculous, you can't pay for this, I can't even pay for it probably.
Right.
But I owe it to you to let you know that it's an option.
Right.
I'm not there to diagnose your pocketbook, because I don't know. I've met people in my 30 years who, if I looked at them, I'd say, oh, they probably can't afford this.
And be like that.
And they could.
Yeah.
They had a trust fund, or they had an inheritance, or whatever.
Smart people.
And they deserve to be treated with, this is the best, this is the price. Sticker Shock is going to probably smack them in the face, but you deserve to know that it's an option. Then there's another option. Then there's another option, and then there's another option.
It's just having an option, period.
Right, and then now they're informed, right? We call it informed consent. Right. That means you got all the information so that you can make the decision. Now, I don't make the decision.
Right.
I might say, based on what you told me you want, you can't wear a denture because you're a gagger, or because it makes you feel old or whatever, then that's not what I'm going to recommend. But if you tell me, hey, I'm on a fixed income, I have to watch my finances or whatever, then I say, well, we're going to make you the best denture we possibly can make.
Right.
How you want to look? Okay, at least we'll make it look good. We'll make it fit as best we can, and it fits into your budget, or you have the money. Hey, we're going to do implants. We're going to do it this way. How do you, and then we lay out that plan. So that's the way I want to be treated.
You like from seed to sale, basically.
Yeah. But I don't push anything. I don't push it.
But I mean, you make sure they get what they're supposed to get. You make sure if it didn't come right, you'll fix it on the spot for them.
Oh yeah. But listen, we had talked about. You talked about wanting to be a judge. And you like to read and all that type of stuff,
right?
And like how we choose our career,
right?
I know when I was growing up, I thought I wanted to be an architect at one time. And I also could draw too. So my grandfather used to always say, why are you always sketching something and then you tear it up and you throw it in the garden? I would never save it.
Right.
And I was a pretty good sketch artist with a pencil. I could sketch, and give it like 3D. And I was always good at like spatial relationships things, and I thought I wanted to be a medical doctor.
Right.
But dentistry just brought all that together,
Right.
So really, one of the things that I, at least in my specialty, is like I'm an architect of the mouth.
Oh,
So,
definitely.
so even though I'm not an architect of buildings, I'm an architect of building your smile,
Right.
putting your function back where you can eat and chew and all that type of stuff.
And just self-esteem. Sometimes people's self-esteem
yeah,
goes because
right. Well, well, your teeth. What do people see first, right? They see your eyes and they see your teeth. You know, if they're making eye contact with you, they're looking right at you.
this day they checking out your feet, they checking out everything.
Well,
you
they're
know?
checking everything, but you
right.
know, studies will show that people's eyes are drawn to your eyes when they're talking to you and to your mouth. So obviously, if your teeth are bad, most people are going to do this or not smile and things like that. So that's a social thing, and so really. Where it doesn't matter if it's a denture or if it's implants or it's a bridge or something like that. They want to look good.
They sure do.
They want to look good. That's one thing for sure.
Right.
They want to be able to eat and function and bite down and not have pain. You know, so
and not have the teeth flying out and fluting.
Right. So really, if you're a patient, you want all those things, and not every dentist is built to do more complex cases. If you have a cavity, every dentist should be able to take care of that. That's what they went to school for, you know. If you have, one missing tooth, that's relatively easy also.
Right.
But when you got multiple big things going on, not every dentist can handle that because one, their schedule is not built to focus on that big problem, or they don't have the training, you know, or it's not something they want to do. You know?
Right.
Like me, like if I do a full mouth rehabilitation, I got to sit there and make sure that I planned it, first of all. It's a plan first. There's a blueprint, there's a plan, and then there's the knowledge of all the materials it's going to take to execute that plan. And then it is, as the plan develops, there might be some little changes you have to make because, I thought this tooth was going to be good, but it's not. Now I got to, adjust the plan.
Right.
And then you have to execute. And then you have to know what lab you want to work with, what kind of materials you want the lab to use, and you have to be able to communicate to the lab. There's a lot that goes into, like, the more advanced dental problem.
Right. I mean, look at the time. Time goes so quick. But it's so much that we didn't hit on, like the implants, that's without the screws now.
Right.
The teeth growing back, okay? Right. You heard about that, right? They're able to get people.
Oh, with the stem cell?
But people think it's like, I'm missing one tooth, I'm gonna grow it. No, all the teeth is gonna grow.
Well, yeah, there's a lot of studies going
behind
on.
it, right?
Yeah, right. But I mean, right now, I feel like dentistry's come a long way. It's more the ones that have kept up with the technology. It's come a long way. I don't know how mainstream a lot of things are because everything's expensive. For a lot of these technologies, especially the newer ones, it's a lot of investment of time and money for the office that's investing, in technology.
Right.
So we have to see how mainstream it becomes, but the sun is shining. Things are getting better.
They are, especially if they visit your office. Please tell us about the robot because I'm gonna have to come pay a visit and meet this robot in person.
Oh yeah. So fortunately, we are the only office in Staten Island, and a very few, one of the few in the country that are involved in robot-assisted surgery for placing dental implants. And so the misconception could be that, so a robot's placing my implant, but that's not true. It's that we have a software that plans where we're going to do the surgery and how we want to do it, so where the implants would go. And then the robot is synced up to that plan, so that when I hold the handpiece and the robot actually is with me, when I get over the spot where I want to place the implant surgically, it locks in. So all I have to do is just push upward, and I can't get offline. So the implant gets placed where I planned it. It's never off.
Right, it's
at all.
accurate. So that means
Right,
a
so
mosquito can bite you. You can go like this, and then the robot is not gonna go like that either.
Yeah, well, like if you're near like a nerve or you're near a sinus and you want to avoid it, but you want to go right up to the sinus, I can place an implant right to the sinus without going in it. Or if there's a nerve that I want to avoid, I can place that implant right to the millimeter right before I would enter the nerve. Now, if I had to do that by hand,
Taking a chance.
yeah, because I can't feel. You can't feel to that level.
Right.
Or if the bone is like that, as if it's narrow, and I want to put an implant that's perfectly placed within that. If you do it by hand, you might lean a little bit. Even though you think you're doing great, but the robot does. The robot helps you to put it. It's very precise. It's quicker, less X-rays because you don't have to check each time you do something. So there's a lot of benefits. You don't have to sweat. Or somebody who can't open real wide, like there's probably a lot of people who might be listening who have trouble keeping their mouth open real wide for a long time. With the robot, you don't have to open up as much because you can come in laterally and then place the implant. And so you do it faster and more comfortable.
Right.
And you're in and you're out.
Right.
So that the person doesn't have to leave with like a soreness or things like that. So a lot of benefits, to that.
We can't go any further. How can they get in contact with you? Do you have like an email or something that you use?
Yeah, well, I do TMJ, people with jaw pain, so they can go to, you can actually go here if we run out of time, Staten Island TMJ.com.
Okay.
Is one way to get in touch. And then I'm at, I'll give you the phone number. They can call.
Yeah, you can give it to them.
They can call 718-356-9700.
Okay.
718-356-9700. That's a number where they can get to all the offices that I work.
Okay.
Yeah.
That's good. Now I'm gonna have to go back and look at that and write that down because but I got your personal number. So
Right.
It's not hard.
Yeah.
Wow.
Yeah, we have to do another show.
Yeah, we do.
Yeah.
And I'm glad you brought that up because you did a show here maybe like 10 years ago, we'll say.
Yeah, I was here. Yeah, and I talked a lot about plaque removal and the overall oral health and how it affects your body. Yeah.
Just mention the big tooth. If you say the big tooth, they'll be like, I remember.
I had the big tooth, and we showed what it looks like, in between the gum line where that bacteria enters the body and can cause problems.
Right, and it was very much needed, you know what I'm saying? Because like I said, it's like a stigma there where people they're not educated about this and dental and importance of brushing and flossing and what plaque can do and to the last minute.
Yeah, well, again, I have a young boy. He's probably 13 or 14, and he's terrible with his plaque removal. So he's got cavities forming everywhere, and I don't know how to impress upon him, but he's going to be having trouble with in the future.
Is it like a genetic thing?
There's genetics at play for sure, but I think the key thing is habitual habits. Like if you do plaque removal and you make it a habit of doing that, then genetics is not as much of a factor.
Right.
But genetics is definitely
your house clean.
Yeah.
Clean.
Right.
You won't have to do a big cleaning all the time.
Yeah. Then genetics is your body, because it's basically your body's response to plaque. But if there's no plaque, there's no response.
Right.
You know what I mean? So plaque, you just want to remove that plaque. So the more a person is educated on that and then makes it a lifetime habit of plaque removal, it'd probably be good.
And how often should they actually see a dentist?
Yeah, you need to, everybody's different. I know that there's a general number of twice a year, every 6 months, you go to your dentist.
No, actually that because we got some dentists that wants to milk the system, so they're going to see you twice a month. You understand what I'm saying?
Yeah. Well, but I'm saying in general, what are we trying to do? We're trying to head off problems early.
Right.
So twice a year check is fine.
And then cleanings.
Yeah. Twice a year you go for your your every 6 months you get your checkup, you get your teeth cleaned by a good hygienist.
Okay.
And everybody's going to need a different type of cleaning. Like if you're already doing your homework at home, then your cleaning should be easy squeezy, right?
Right.
But if you're not doing your job, at home, and you come in to get that good cleaning every 6 months, then you're going to be in the chair a little longer. It's probably going to be a lot more involved, So, but if you're doing your floss and you're doing your plaque removal every day, then the hygienist really not doing much because you've already done the job.
But you don't see no advertisement. You don't see no. You know what I'm saying? It's like when it's in your ear and you're seeing it all the time, then you remember. Like when I was growing up, you see the commercial, you brushing your teeth.
Yeah.
You brush your teeth 5 times, 10 times a day.
No, then we
as
need
the
to
commercials come.
I wish that we could do a better job, as a public, announcements. But even if you're missing all your teeth and you're wearing a denture, well, what other doctors looking in your mouth to make sure you're not having any kind of strange growths? Oral cancer is a thing, it's not super common, but if you had some kind of a thing going on in your, cancer can affect the tongue, the sides of the cheek, the floor of the mouth. No other doctor is going to be checking that. So, at least once a year, for that kind of patient, just go get your dentures checked, make sure that everything looks good. So I think it's very important. Every single person on the planet should go to the dentist at least once a year.
Oh,
And if you have all your teeth, twice a year, so that you don't have to see somebody like me,
Right.
who takes care of big problems.
Right.
You know what I mean? Like just go in and go see your hygienist, have a dentist come in for a quick check, and get it over with, and make sure you're good.
Okay.
Yeah.
All right. And did we miss anything? Because we definitely have to pick this up again because I didn't get a chance to even get to. You mentioned the baseball, but we didn't talk about the basketball.
Oh yeah, the basketball's still my
still
passion.
going, right?
Still going every day.
Right.
Yeah, that's what keeps me moving.
And keeps you healthy, keep you in shape.
Yeah, it's to me, moving your body is super important, and if you can do it while you're doing something you love to do, whether that be riding a bike or going for a walk. For me, it's basketball. I get in 5 to 7 miles on a pretty regular basis.
What you got, an iWatch on there with the watch tell
I got my iWatch that lets me know.
Right. You got the Apple Watch, right?
Yep, the Apple Watch. Yep, exactly.
Okay.
Yeah,
all right.
Yeah. So I would love to come back and talk about sports.
Yeah,
or,
we definitely
how it relates to mental health and health. You have to do something. You got to move the body.
Yes.
You have to move it. It's it helps get out toxins. It helps you to breathe, better. It keeps your lungs in shape, keeps that
Get to these
circulation
ages,
going.
right? Get to these ages, and
yeah,
right.
And you don't have to do anything like I do. I think I'm on the excessive side a little bit,
okay.
but there's plenty of things you can do to keep your circulation, keep your heart right, keep your sense of well-being up there.
Right, and that's another thing. It's like gives endorphins to your brain.
Yeah, your own endorphins going.
Right, you don't need drugs. You
Right,
know what I'm saying? Right.
Yeah, your own self-manufactured drugs are the best.
Right.
Yeah.
But it's from being active. It's from getting out there, and Lord, the time goes so quick here. We're gonna say healthy teeth brings a healthy body, and I'm gonna thank you, Dr. Pedro, for coming in. Making it here, you know what I'm saying? It's been in the making, but we did that.
Yeah, well, we'll do another one. I want to thank you and for all the good work you're doing. And you've been here for 11 years?
13 years.
13 years.
What kind of math you
sure.
doing?
Excuse me, sorry. Yeah, congratulations. You're to be applauded, and keep up the good work. And let me know when I can come back on.
Whenever.
All right,
Dr. Pedro.
All
You know
right.
what I'm saying? And
Yeah.
until then, we will see you next time. Make sure you like, subscribe, follow. The information was back here. I got to put it back up there. We're missing my YouTube, everything there.
Oh, I'll have to come back. I'll have to come back for all that.
Oh, I could give it to you, right? That's easy. But for my viewers at home, they need to see that there.
All right.
Right. So until next time.
Peace.
Yeah.
Rasta music, Rasta music.
So that's all y'all working?
Mm-hmm.
Yes, yes. S-I-N-Y. Yeah, man. Yes, I. Yeah, I